Hello everyone, welcome to our channel Share It, the art of sharing knowledge. Today we are going to discuss about atherosclerosis. This is presented by Nitin and Arathi Chandran. The word athero means related to artery and sclerosis means abnormal thickening. So in short, atherosclerosis is defined as a process in which abnormal deposits of lipids, cholesterol and plaque build up leading to coronary artery disease and other cardiovascular problems. Incidence of atherosclerosis. According to WHO, 31% of death worldwide is due to cardiovascular problems.
Here in this graph, you can see a gradual increase in the incidence of cardiovascular diseases globally.
Next, we are going to discuss about etiology and risk factors of atherosclerosis, which we can divide it into two non-modifiable and modifiable risk factors. Non-modifiable risk factors are those which cannot be modified: age, gender, heredity, and race. Modifiable are those we can modify: hyperlipidemia, obesity, smoking, lifestyle, stress, hypertension, and diabetes mellitus.
Next, we will see the pathophysiology of atherosclerosis. Due to any etiological factors which we have discussed priorly, both modifiable and non-modifiable risk factors, it can either lead to thickening of the arterial walls or deposits inside the lumen of the artery. Any of this or a combination of both of this can lead to narrowing of the lumen of the artery. So if the lumen is getting narrowed, there will be decrease in the blood supply to the area due to obstruction. Here in this picture you can see the accumulation of plaque inside the lumen of the blood vessel, which is obstructing the blood flow.
Next is the clinical manifestations of atherosclerosis. Chest pain is otherwise called as angina pectoris, dyspnea, that is breathing difficulty, diaphoresis, otherwise called as excessive sweating, anxiety, nausea, and vomiting.
The pain is of radiating type. It will be radiating to the arm and even the back. Next we will see what are the diagnoses for atherosclerosis. First is collecting a relevant history which will be able to find out what are the etiological factors. Next is conducting a complete physical examination which will be including cardiac assessment. Obtain an electrocardiogram to see for any variations in the ECG including ST depression and ST elevation. Do a 2D echo to see the left ventricular ejection fraction. Next is coronary angiography, which is an invasive procedure to find out which artery is affected and how much it is affected. Other than these investigations, blood studies to see cardiac enzymes and serum cholesterol level, and also arterial blood gas.
Next is the management of atherosclerosis, which we can divide it into 3 sessions. First is medical management of atherosclerosis. The second is surgical management of atherosclerosis. Then nursing management of atherosclerosis. First is the medical management of atherosclerosis. In that, non-pharmacological management. Administer oxygen, provide bed rest, provide comfortable position to the patient, lifestyle changes. Next is the pharmacological management. In that, lipid lowering medication, example atorvastatin, antiplatelet, example aspirin, beta blockers, example metoprolol, calcium channel blockers, example nifedipine, ACE inhibitors, example captopril, diuretics, example furosemide, other medications according to etiology.
Next, we'll see what are the surgical management for atherosclerosis. First one is thrombectomy, that is the removal of thrombus from the artery. Second is coronary angioplasty and stenting, which is an invasive procedure. Third is endactectomy, that means separating the plaque from the arterial wall, and other one is bypass surgery.
Next is the nursing diagnosis of atherosclerosis. First is impaired tissue perfusion related to narrowing of lumen as evidenced by decreased SpO2 level and dyspnea. The second is impaired breathing pattern related to inadequate oxygenated blood supply as evidenced by dyspnea. The interventions are assess general condition of the patient, monitor vital signs, monitor arterial blood gas, monitor SpO2 and capillary refill, watch for peripheral cyanosis, provide comfortable position, administer oxygen. The third one is acute pain related to improper blood supply to the area, as evidenced by verbalization of patient and pain scale score. The interventions are assess the characteristics of pain, provide comfortable position to the patient, reassure the patient, monitor for complications, cardiac monitoring, administer analgesics as per doctor's order. The fourth one is anxiety related to fear of death as evidenced by verbalization of patient. The interventions are reassure the patient, explain the treatment, provide psychological support, provide health education to the patient and relatives, provide calm and quiet environment, provide privacy to the patient.
Next, we'll see what are the complications of atherosclerosis. It includes, first is coronary artery diseases. Second is myocardial infarction or otherwise heart attack. Third is cerebrovascular accident or stroke. And peripheral vascular diseases.
Next is the preventive measures of atherosclerosis, which we can remember as a mnemonics, that is health. H stands for health checkup, E stands for eating healthy diet, A is activity, L lifestyle modification include quit smoking, T stands for treatment at the earliest, H stands for healthy mind, that is avoid stress.
Thanks for watching our video. If you like the video, please like, share and subscribe.